Every few years, dentistry rediscovers something so effective and so simple that it almost feels uncomfortable to believe. Silver diamine fluoride, or SDF, is one of those things. It costs just a few dollars, takes less than a minute to apply, and yet has been shown to stop decay in its tracks. But here's the real question. Does it actually arrest caries long term, or is this just a temporary fix that stains teeth black and buys us time? Let's look at what the research really says. If you've ever had a high-risk patient, a child with rampant decay, an elderly patient with root caries, or a special needs patient who just can't tolerate restorative treatment, you know the power of having a non-invasive way to stop the disease process. SDF promises exactly that: a quick, painless, inexpensive way to halt active lesions and prevent new ones from forming. But as clinicians, the question isn't whether it works short-term, it's whether it holds up long-term. So let's start with the basics. Silver diamine fluoride, it's a clear liquid that combines silver, fluoride, and ammonia. The silver kills the bacteria responsible for caries. The fluoride promotes remineralization and strengthens the enamel and dentin. And the ammonia keeps the solution stable and alkaline, which helps neutralize acids and promotes healing. At 38% concentration, SDF contains about 44,000 parts per million of fluoride, roughly double that of a standard fluoride varnish. When it's placed on a lesion, the bacteria die. The soft dentin hardens, and the surface turns black as silver oxide forms. That's the visual confirmation of arrest. It's not just the surface chemistry. Researchers have found that silver and fluoride ions actually penetrate deeply into dentin, forming a new mineral layer that resists further acid attack. And even more interesting is the dead bacteria that have absorbed silver can continue killing live bacteria nearby. That's what scientists have called the zombie effect. It's a sustained antimicrobial zone that keeps protecting the tooth even after the application is complete. So what does the evidence show when we step back and look across multiple studies? Well, one of the first major systematic reviews came from Gao and colleagues in the Journal of Dental Research in 2016. They analyzed 16 clinical trials involving over 2,000 children and found that SDF arrested about 81% of active carious lesions in primary teeth, far outperforming any other non-restorative treatments. That was one of the first big wake-up calls that this wasn't just folklore from Japan, it was real science. Then in 2017, Chabinsky and coworkers published a meta-analysis in Caries Research that compared SDF to alternative treatments and placebos. They found that SDF was 89% more effective at arresting cavities or cavitated carious lesions after 12 months. 89%. That's the kind of number we just don't really see very often in preventative dentistry. But the biggest leap forward came recently with the CariedAway Trial published in the JAMA Network Open in 2023. This was a massive real-world study in New York City public schools involving nearly 3,000 children. Researchers compared SDF plus fluoride varnish to traditional glass ionomer sealants and varnish. After 2 years, the percentage of children with arrested caries was 56% for SDF and 46% for sealants. The prevention of new caries was virtually identical, about 81% for both groups. In short, SDF performed just as well as sealants at 2 years, without any drilling, without the need for isolation, and with almost no cost. That's not just effective, that's practice changing. Now, what about the long-term data? Well, there's a recent systematic review published in Frontiers in Oral Health in 2024. It pulled together 10 years of studies and confirmed that SDF consistently arrests decay and reduces the incidence of new lesions, especially when it's applied twice a year at the 38% concentration. The authors also noted that evidence beyond 3 years is still limited, but most studies stop around 2 to 3 years. But every trial so far shows that the arrested lesions stay hard and stable as long as reapplication continues. We've also seen expanded use in adults. Several clinical trials on root caries in older adults, they show the same thing, similar results. The arrest rates ranging from 60 to 80% depending on your frequency. And even beyond caries, new pilot studies have shown the reductions in plaque and gingival inflammation when SDF is used regularly. So yeah, the research overwhelmingly supports SDF for caries arrest, but it's not without limitations. The most obvious is the black staining. SDF permanently discolors decayed dentin, but not sound enamel. So for posterior teeth or root surfaces, it's usually not really a concern, but for the anterior aesthetic zones, especially in kids, you have to prepare the patient and parents ahead of time. Most families still choose treat when you explain that it means avoiding anesthesia, drilling, and cost, though. So, and while SDF is powerful biologically, it's obviously not a restorative material. It doesn't rebuild form or function. So that, interestingly, is where the SMART technique came from. It's silver modified atraumatic restorative treatment. You apply SDF first, then you cover the arrested lesion with glass ionomer. This seals in the silver, strengthens the tooth, improves the appearance, and continues releasing fluoride for added protection. In many cases, SMART restorations last as long as traditional fillings, but with fewer recurring lesions. There's also a small failure rate, roughly 10 to 25% of lesions. They may not fully arrest or they may reactivate, especially if follow-up care or your reapplication is inconsistent. So while it's incredibly effective, it's not magic. It still requires monitoring and reapplication every 6 months for the best results. Now, as for safety, this is one of the most studied preventative agents in dentistry. Research from May and colleagues in the Journal of Dentistry, it showed no detectable systemic toxicity or dangerous silver or fluoride levels after use. The amount applied is really tiny, typically less than 1 drop per patient. It's considered safe for both children and adults, although it's not really recommended for direct pulp exposures or anyone with a known silver allergy. So you may see some temporary soft tissue staining if it contacts the gingiva, so you do want to isolate. Isolation's key, but otherwise it's extremely well tolerated. So now, for this treatment, who benefits the most? Well, it's children with early childhood caries, elderly patients with root caries, patients with disabilities or limited access to care, and really anyone medically compromised who traditional dentistry is kind of risky to do. It's also showing promise in preventing radiation caries in head and neck cancer patients if you apply that before and after radiotherapy. So that's something that's currently being studied in multiple clinical trials. So what's the best way to use it? Well, the highest quality evidence supports just 38% SDF applied twice per year. You dry the tooth, isolate with cotton, apply a small amount with a microbrush for 1 minute, and then don't rinse. You can cover it with fluoride varnish if you want to reduce that metallic taste, and it helps provide an extra seal. Reapply it every 6 months or more often if the lesion still feels soft. I always obtain informed consent, documenting the expected black discoloration and the possibility of retreatment. Well, now let's talk about the bigger picture. At a time when we're facing workforce shortages and an aging population, SDF actually offers a simple, scalable, evidence-based way to manage disease and reduce the restorative burden. The WHO even added SDF to its model list of essential medicines, meaning every country should make it available for public use. And when you think about the ethical side of dentistry, prevention, patient comfort, affordability, SDF really just checks every single box. So does silver diamine fluoride really arrest caries long-term? The research says yes, and impressively so. Multiple meta-analyses show arrest rates above 80% in kids in primary teeth, and the other trials demonstrated equivalence to sealants over 2 years. And then studies in root caries show similar success, and while we still need more long-term data beyond 3 years, no evidence suggests that the effect fades with reapplication. When used correctly, SDF is durable, safe, and extremely cost-effective. It's not pretty, but it is powerful, and for many patients, it can be life-changing. So here's the bottom line. Silver diamine fluoride isn't just another fluoride product. It actually could be a paradigm shift in how we manage caries. For high-risk, underserved, or medically fragile patients, it offers painless, affordable disease control. Use 38% SDF, reapply it twice a year, and consider recovering with glass ionomer for form and aesthetics. Document, educate, and then monitor. The only wrong way to use SDF is just to ignore it when it's indicated. The evidence is really clear. It works, and it works long-term. Let's make dentistry more fun, fulfilling, and rewarding. Subscribe so you don't miss the next episode of The Research Says, and I'll see you soon.